Hello, my name is Dr. Srikanth V. Now, what is face contouring? Now, face contouring is a procedure where you contour the face. Typically, it is to tackle the aging face. What happens in aging is that the effects of gravity, your age, and sometimes lifestyle like heavy smoking and all will cause the skin to be a little lax and it starts sagging. So the sagging happens around the eyes, it can happen in the mid face, it can happen around the jowls. So in some people there is a fat accumulates around the jowls and the chin, and with advancing age you get some loose skin, lax skin around the neck. Now to change all this, you will have to contour the face, and that is known as facial contouring. Can it be done non-surgically? Yes. Few things can be tackled non-surgically, few things can be tackled with a minimally invasive thing like a lift, and a few things which will require surgery only if you want to recontour your face. Now, this is a decision best left to your plastic surgeon. It is very difficult for one person to decide whether, I want this, I want that. If you meet your plastic surgeon, he will tell you, yes, I can do this non-surgically. These are the things which needs for full-fledged surgery, and this is what will result in a freshly contoured face. Facial recontouring, as you all know, is to tackle aging. Which are the parts that can be contoured? That entirely depends on how the person has aged. Some people will require eye lift, upper eyelid only. Some people will require lower eyelid. Some people will require both upper and lower eyelid, and that gives them a refreshed look. That is known as a blepharoplasty. Certain people have only a fat accumulation around the neck and chin, and that can be contoured with a simple liposuction. However, damage gets worse, then they require more and more contouring, which you may require threads, you may require liposuction, you may require a combination of all, you may require a complete facelift, a neck lift, and all of these depends on what kind of aging that you have undergone and what kind of contour of the face that troubles you, that needs to be addressed. A lot of things nowadays can be addressed with a simple thing like a thread lift. Something may require a combination of thread lift and a liposuction, some cases liposuction and a lipofill. All these are involved in rejuvenating the aging face. There are two ways of looking at facial contouring. One is the non-surgical part, one is the surgical part. The non-surgical part of facial contouring involves minimal or no invasion into the tissues. It just adds a little volume here, adds a little volume there. You may have to put a little Botox here and there, and that will change the contour of the face. And this works very well in certain selected people. However, most of these non-surgical methods are temporary. They may last anywhere between 6 months to 2 years. So when you say temporary, it means that it has to be repeated, and that is a recurring cost that will keep adding on to you. Surgery, on the other hand, is more invasive. It may very likely involve general anesthesia. There will be scars. Some of them will be hidden. Some of them, if you look very closely, you will see. But the results of surgery are more longer lasting. They last up to 5 times 7 years. And for many people, one surgery is all they require in all their lifetime. So these are the two main differences between the non-surgical and the surgical approach. One of them is temporary, recurring cost. Other one is invasive but lasts a little longer. Who are the candidates to undergo face contouring surgery? These are the people who are unhappy with the way they look. They are unhappy the way they have aged. That means over a period of time they find that they're looking not as anticipated. Damage related to age and gravity is more and more pronounced, and these are the people who should seek help regarding facial contouring, because very many things are there, very many new things are there, whether it is concerned only the upper third of the face, the middle third of the face, the lower third of the face, the neck, the cheeks. Lots of the problems can be addressed. Some of the problems obviously cannot be addressed, some can be addressed. So I suggest that you meet your plastic surgeon, discuss with him what all needs to be addressed so that you can get a new, refreshed look. Which are the parts that can be contoured? That entirely depends on how the person has aged. Some people will require eye lift, upper eyelid only. Some people will require lower eyelid. Some people will require both upper and lower eyelid, and that gives them a refreshed look. That is known as a blepharoplasty. Certain people have only a fat accumulation around the neck and chin, and that can be contoured with a simple liposuction. However, damage gets worse, then they require more and more contouring, which you may require threads, you may require liposuction, you may require a combination of all, you may require a complete facelift, a neck lift, and all of these are depends on what kind of aging that you have undergone and what kind of contour of the face that troubles you that needs to be addressed.